Hi, and welcome to Dr. Steve's Science Spot. How brain implants are treating depression. One of the patients involved in the trial is Tom.
First, they screwed my head into a frame to hold it still. Then they numbed me and drilled 2 small holes through the top of my skull, one on each side.
An estimated 280 million people worldwide have major depression. A smaller but still significant number of those will ultimately fall into the hopeless-sounding, treatment-resistant depression, or intractable depression. In the United States, an estimated 2.8 million people have that diagnosis. Now, an experimental surgery that sends electricity into the brain may offer relief from mental disorders. Deep brain stimulation for depression is a medical treatment that involves implanting a device in the brain to help alleviate symptoms of severe depression. The device, similar to a pacemaker, sends electrical impulses to specific areas of the brain that regulate mood. There are now dozens of people in the United States currently in clinical trials that aim to heal mental disorders with brain implants. It's built on the scientific premise that electrical stimulation can reset brains that are in the grip of powerful and devastating psychiatric disorders such as depression, obsessive-compulsive disorder, and post-traumatic stress disorder.
Through each hole, a surgeon plunges a long, thin wire dotted at the end with electrodes deep into the brain. In simpler terms, it's like giving the brain a gentle electrical charging boost to improve mood and reduce symptoms of depression. The wiring is threaded under my skin, snaked around the outside of the skull, and down behind my left ear. From there, a wire is wrapped around the front, attaching to a battery-powered control box implanted into the chest, just below my collarbone.
This procedure is usually only considered for individuals who haven't responded well to other forms of treatment, such as medication or therapy. The patients are Bluetooth-enabled to link to a computer at the hospital. Unfortunately, it is also necessary to charge the batteries. Thank you for watching. Please subscribe if you would like more interesting science from Dr. Steve.